Tradition d'Avenir is born from a simple humanitarian consideration. The large pandemic, such as AIDS, malaria, tuberculosis, are especially striking the southern population, often in rural areas, living in traditional economies and societies with ancestral health systems. We are not talking about few million individuals, but close to 2.5 billion human beings whose daily income do not exceed $2 and whose only possible access to treatment are to use what is available in their direct surrounding. Despite important financial efforts, why the international help is lacking of efficacy with known scientific treatments? Which are the misunderstanding and opposition between the international organization and the population assisted? Why cultural realities of those populations, the understanding of the disease, their therapeutic behavior are not considered and included in the large health international conferences and fora? Why their traditional practices are immediately considered by the Western way of thinking as marginal, concurrent, or faute? Why not implement meeting with those hundreds of thousands health actors in order to help and guide them to join modern and public health systems? From those reasons and evidences, a group of physicians, researchers, and politicians, together with Senator Michel Guéry, have created Tradition d'Avenir. As a parliamentarian, Senator Guéry participated to several international programs, such as the World Bank one in relation with several governments from developing countries. In 2007, he has offered to gather those health professionals, giving them for the first time the opportunity to express their differences, exchange experiences, express the needs, but also think about their integration in a national health system. On this idea, the founders were rapidly supported and joined by different personalities, such as Professor Jean-François Girard, then Director IRD, Sankaran Valyatan, head of ICMR India, Luc Montagnier, Nobel Prize of Medicine 2008, Visha Katosh from the Indian government, and from University of Guatemala, Professor Armando Caceres. Politicians like China Health Vice Minister Professor Wang Guoqiang and former French Prime Minister Jean-Pierre Raffarin. The gathering received the patronage from the French Senate, UNESCO, UNAIDS, and also First Lady of Republic of Cameroon, Lady Chantal Biya, President Synergie Africaine, her country having accepted to host the first edition in Yaoundé.
La population camerounaise est à 60% portée vers la médecine traditionnelle. Nous pensons donc que cette rencontre qui a l'avantage de discuter franchement la médecine traditionnelle, la médecine moderne, pourrait trouver, je ne voudrais pas dire les points communs, mais au moins des passerelles. Et surtout, aura l'avantage de permettre à ce qu'un sujet tabou comme celui de la médecine traditionnelle puisse être évoqué par des grands scientifiques.
2 years have been necessary to prepare, finalize a program and select participants according to their activities in this field. Medical doctors, health system actors, ethno-sociologists, politicians, specialized journalists and traditional practitioners, patient NGO managers, sometimes themselves affected by the disease. 2 years of meeting, listening, convincing, and fundraising. It is only in November 2009 that the first gatherings took place in the capital of Cameroon, bringing together a selected limited number of participants, 100, coming from the 5 continents and several professional backgrounds. All of them ready to exchange on the central topic, the patient from low-income countries facing available therapies. Upon request from local authority, before the gathering, a workshop was organized in May 2009, assembling health professionals from Cameroon willing to voice their concern on the subject and not able to attend the international conference. Those pre-gathering have permitted a better understanding of the daily needs of patients in Cameroon, the organizing country, and also to better structure the November meeting. The key points expressed during the workshop: the actual cultural, social and community environment of the patient, the danger of omnipresence of quackery, the warning of fake drugs, the deficiency related to malnutrition and lack of hygiene, the increasing importance of patient NGO. Those points were regularly raised during the international gathering.
À un moment donné, si on ne fait pas attention, il y a un glissement vers le magico-rituel, ce qui est difficile à gérer. Une fois qu'on soulage un malade, on va demander, bon, est-ce que tu peux me faire quelque chose pour que ma femme revienne? Alors ça, c'est l'aspect un peu négatif qu'on risque d'entreprendre si jamais on ne connaît pas ses limites en médecine traditionnelle.
During those, also the interpersonal relationship between patient and local practitioner, able to better understand the patient within his community. Another common point, the weight of social and cultural taboo surrounding the disease and patients who have to fight. In November, comments were expressed on the social cultural differences of a world which cannot accept a unique way of thinking as universal. For example, the use of words whose meaning differs from one culture to another one, like traditional medicine, covering traditional Chinese or Indian medicines, and also medicine based on oral tradition, like the one from Africa and Latin America.
So your question is how to connect 1,000 years ago that condition created Chinese medicine being treated right now 1,000 years later by medicine. Yeah, actually it's very, very simple. Even we don't know what is AIDS, but AIDS has its specific manifestation, either fatigue, either fever, or either any kind of condition. According to the manifestation, Chinese medicine gives several categories. Yeah, for example, in Chinese medicine, AIDS could belong to Shi Lao, extreme deficiency.
How important it is to save and protect those ancestral knowledges, to develop adapted validation programs, to encourage all efforts related to medicinal plants, community or regional plantation and uses inducing significant incomes, to erase the communication difficulties with international agencies, sometimes isolated and far away from field realities, to mobilize in a coordinated manner the media on disease prevention and national health strategies without forgetting their obligation to fight against ostracism, intolerance and taboo. Therefore, bridges are needed to improve exchanges and implement cross-cultural education programs. Last, to implement social coverage for those debilitated populations, regardless of the therapies in use. Second gathering, co-produced by Tradition d'Avenir, the Lima gathering happened in October 2010. Under the auspices of S. Salud and the authority of Dr. Marta Villar, they took place in Chaclacayo, a close suburb of Lima.
Nuestro sistema de salud aquí en el Perú, el oficial, la medicina convencional, llega a tener una cobertura del 40%. Quiere decir que el 60% de la población se atienden con otro tipo de medicinas. Y hoy estamos viendo de que dentro de la misma seguridad social, desde que se abrió el programa de medicina complementaria hace 12 años, la demanda de los pacientes es creciente, ¿no? De lo que éramos 7 centros de medicina complementaria en el seguro, hoy somos 99 centros. Y eso solo es posible porque los pacientes demandan este tipo de atención, ¿no?
Es Salud, a medical organization covering 8 million Peruanos, was assisted by the Colegio Médico de Perú, by the French Institut de Recherche et Développement and Dr. Michel Sauvin, and by the Pan American WHO. More than 150 national health professionals have participated, coming from the Amazon forest, the Andes, and the coast. Many participants, impregnated by their prestigious ancestral civilization, made the same type of comments related to the local beliefs, their will to be active parts of the natural forces, to be part of the cosmos in its relation to disease and individual health. Therefore, through the knowledge of active medicinal plants, the traditional practitioner has to integrate the community rights in his practice. Aside from presentation and discussions, several patient testimonies were presented, illustrating specific cultural behaviors. During those days, in October 2010, the participants not only recalled the confrontation of the population to great pandemics, but also that they had to face other scourges such as leishmaniasis, dengue, parasitic disease of all kinds. Sometimes the local treatment of those scourges have real efficacy, even though not validated. The Peruvian authorities attending the meeting and conscious of those realities have expressed their desire to produce legal frames in order to extend social coverage for those patients using those health systems. Senator Michel Guéry, Dr. René Olivier and Tradition d'Avenir General Secretary Pierre Noël, attending the gathering, have presented to the participants the outcome from the Yaoundé gathering in November 2009, doing so contributing to the exchanges. This was also an opportunity to remind UNESCO recommendation committed to protect traditional knowledge, to further develop health training programs, mobilizing major international media. In the coming years, Tradition d'Avenir will continue organizing regional and international exchanges on the patient in low-income setting facing available local therapies. Representatives from Latin America, Africa, and India have contacted Tradition d'Avenir in order to build on its expertise, work, and network. Other meetings will happen with a number of themes: validation of treatment, identification and needs, the economy of harvesting on production by small farms of medicinal plants, prevention and its cultural aspect, fight against fake medicine. Restitution conferences are planned with committed local, national or international institutions. Tradition d'Avenir is not a scientific organization, nor is it a foundation. It is a political tool oriented towards a complementary health definition in low-income regions, committed to improve communication between communities, and decided to have a different speech, not adhering to the classical certitudes and dominant thinking. Tradition d'Avenir was born from an idea to be shared.